Welcome to our low back exercise video. When we've had persistent or long-term pain, we often reduce the amount of exercise or activity that we do and can become stiff and lose strength, causing a cycle that can actually lead to increased pain. Remember that movement is good for our bodies. Our joints and muscles are made to move. Movement and exercise can help our muscles stay strong and our joints flexible, and can also reduce your volume switch of pain. You may wish to choose just one exercise to begin with. Work out which level of exercise is right for you to start. In other words, try to find your baseline, the amount of exercise or repetitions that you can do that doesn't give you a flare-up of your symptoms. Start off small. It may be that you do 1 or 2 repetitions to begin with. Then as you gradually gain in confidence, you can start to build more. You can gradually increase the number of exercises that you do. Aim for your exercises to be sustainable. This will help you to avoid booming and busting. So try to avoid doing one big session in a week, because this might set you back for the next few days. If you notice an increase in your symptoms, you may need to decrease the number of exercises that you do, or go back to the easier level for a while until symptoms settle. Lisa and Steph are going to take us through this set of low back exercises today. These exercises are good for increasing movement and reducing stiffness, helping with activities such as turning in bed, getting up out of a chair, or bending forward to pick something up, and generally regaining your normal movement. So let's get going. Lisa to your left, as you look at the screen, is going to be showing us how you might start these exercises, showing slightly smaller and less challenging movements. Steph to your right, as you look at us, will demonstrate the movements with a slight progression. First exercise, Lisa needs to hold on to a stable surface, feel safe. She's just gently bending backwards and then returning to the start position. Steph placing her palms in her low back, again just bending gently backwards. She can go a little bit further than Lisa. The next exercise, Lisa again holding onto a stable surface, just sliding one hand down the side of a leg, bending sideways at the waist. Steph's able to go a little bit further with this movement. Steph could hold on to the side if she needed to. You're likely to hear clicking noises while doing these exercises. This is totally normal, and often it just means your back is a little stiff and needs to move. The next exercise, Lisa's going to have a seat, and we're just getting some movement in the low back. She's just slumping down and sitting up tall. Steph's going to do this movement while standing, placing her hands in her low back, just tucking her tailbone under, squeezing her glutes or bottom as she does so. Lisa is going to show us our starter exercise. She's lying on the floor with her feet hip width apart. We're just going to get a little bit of movement in your low back. She's just gently lowering or squashing the low back towards the floor. You may feel your stomach muscles having to work a little, which is normal with this exercise. This exercise is known as the pelvic tilt. It's just to get some movement in your low back. And if we look at Steph, she's able to progress now from the pelvic tilt up to the bridge, just lifting her bottom off the floor, then bringing herself back to the start position. Try not to let your low back arch during the lift. You may feel your bottom, thighs and stomach doing some work with this exercise. This is normal. If you feel the back of your thighs cramping, Try bringing your feet slightly closer to your bottom during the exercise. Ideally, you want your feet about hip width apart. Moving on into knee rolls, lying on your back with your knees bent. Lisa's just allowing her knees to roll from side to side. She's just going a small way because she's just started this exercise. Just to where it's comfortable for her. Steph is now going to demonstrate knee rolls. She's been practicing this for a few weeks. She can now go a little bit further. So he's doing a slightly bigger movement. And can actually take her knees towards the floor. Knee hugs is another nice stretch or movement for your low back and also gets your hips and knees moving. Lying on your back with your knees bent and your feet on the floor, Lisa's just bringing one knee up towards her chest as far as she's able and then placing the foot back to the floor. She could assist this movement with her hands if she wanted to bring the knees slightly further towards her chest and then return to the start position. Steph is going to demonstrate knee hugs in a slightly more challenging way. Just being able to bring her knee slightly further towards her chest. She's been practicing this for a few weeks, so can get a little bit further now. She can also bring two knees together towards her chest and then return her legs to the start position. This is the last exercise in our low back series. Lisa is just going to slide her hands forwards on her knees. Is just resting her elbows onto her thighs for a stretch in her low back. Steph has gained more confidence now and is able to do a bigger movement, taking her hands towards the floor. And even a little bit further if she feels able to.